It's humbling to see a human heart, more so when it's yours, especially when it's not beating. For most of my life, I've been a proactive reporter, from hitching a heart-stopping ride with the Blue Angels.
Warning. Warning.
Now that we've talked about this dive, let's go check it out.
To exploring Florida's exotic underwater world. My work has been my life's hobby, and writing about it has been my passion. But the adventure came to a sudden stop last summer by this.
To the point where you can almost barely see it move.
This is an echocardiogram of my defective aortic valve, which is failing.
But in your situation, you had worn that valve out. I mean, it was totally blocked up.
The aorta is the body's largest artery. Extending from the left ventricle at the top of the heart, it sends oxygen-rich blood to the rest of the body. But when it doesn't work...
So the classic symptoms are breathlessness or change in level of ability to do things, chest pains or angina, and then the last thing is passing out.
Left untreated, people die.
Once you start getting symptoms, 80% of people are dead within a year or two.
Sobering words, especially when my original diagnosis was made 1 year earlier after I first moved to Charlottesville.
I have an announcement to make. I'll be undergoing heart surgery this week to repair a defective valve.
With time running out, on August 1st, I checked in to UVA's Heart and Vascular Center for open heart surgery. Dr. Crone and his surgical team opened my chest and break my breastplate. They then hooked me up to a heart and lung unit, cooling the heart down, stopping it long enough for them to do their delicate work.
Then we opened the aorta. Once we open the aorta, we can see the valve very easily, and we remove it. Now,
there are two types of replacement valves: animal tissue from cows or pigs, or man-made mechanical valves. In my case, it was animal tissue. It's an operation that Dr. Crone will perform more than 200 times a year. Nationwide, each year, there are nearly 100,000 valve replacement surgeries. Other high-profile patients include Robin Williams, Arnold Schwarzenegger, and Barbara Walters. The operation will last 3 to 4 hours, followed by another couple of hours in intensive care. But after that, the first stage of the recovery is fast. I was out of bed and walking the next day, and 4 days later, I was discharged from UVA.
People are in the hospital 3 or 4 days now, and it used to be they'd be in the hospital 2 weeks.
Recovery at home takes about 6 weeks. 6 long weeks of no lifting, no driving, no fun.
The road to recovery is often a road or a track, or in this particular case, a treadmill. Doctor's orders that once you're able, you walk.
For over a month, I've been working out in a high-tech cardio rehab center at Martha Jefferson Hospital. Here, a team of professional trainers and registered nurses use wireless monitors to keep track of my heart as I go through a prescribed exercise routine of treadmills, ellipticals, and rolling machines. I owe my life to cardiologist Dr. Tim Williams and thoracic surgeon Dr. Irving Crone, and to the diligent work of a battery of healthcare professionals at 2 great hospitals in one very fortunate community. Their work gives many of us a new chance to keep our dreams alive. To them, thanks, and I mean that from the top of my heart. For NBC 29 HD News, I'm Ken Jefferson.
It works for me. There you go. So you kind of just hanging there in the strap. Pretty comfortable? Yeah. All right, I'll roll it back out.